teriparatide for 2 years on osteoporosis in patients with RA.
Thank you for the introduction. My disclosure. Although medication for RA has been improved by early intensive treatment using MTX and bio for decades, treatment of concomitant disease in RA patients such as osteoporosis, OP will be more important to improve activity of daily living of RA patients. Appropriate treatment strategy for OP in RA patient is necessary. Daily teriparatide TPTD treatment is one of the promising options. OP in RA patient is composed of multifactorial pathogenesis such as excess of inflammatory cytokines, drug used for treatment of RA, especially corticosteroid, excess of rest due to joint pain, and influence of postmenopausal OP. This prospective study investigated 1. The efficacy of TPTD for 2 years on OP in RA patients, 2. The predictor of efficacy at 2 years in TPTD treatment, and 3. The outcome of combination of TPTD and bio. Uh, 24 months passed after the initiation of TPTD in 33 RA patients. 28 cases among them completed 2-year TPTD treatment and were used for analysis. Oh, sorry. What? I'm sorry. BMD of lumbar spine and proximal femur, in other words, total hip, were measured by DEXA every 6 months. For bone turnover markers, BTMs, BAP, P1NP, NTX, and TRACK-P5B were measured every 6 months. BAP and P1NP were the markers for bone formation, and NTX and TRACK-P5B were the markers for bone resorption. The mean age was 72 years old. 32 cases were female and 1 case was male. The mean RA duration was 20.2 years. 23 cases, 69.7% were concomitant with oral prednisolone. 14 cases, 42.4% were concomitant with bio. The mean flux was 40%, and 27 cases, 81.8% had a past history of fracture. First results. Time course of BMD is shown. TPTD treatment has significantly improved LS-BMD and PF-BMD in our patients after 6 months compared with baseline. In addition, rate of improvement in BMD has decreased but is still significant for the second year. A percent increase of LS-BMD was 11.2% at 12 months and 12.5% at 24 months. A percent increase of PF-BMD was 4.0% at 12 months and 5.8% at 24 months. LS-BMD and PF-BMD were rapidly improved during the first year and showed a gradual improvement during 2 years. BTMs were significantly increased after initiation of TPTD treatment, and increase of P1P at 6 months was maximum among them, 384%. Second result. Next, all cases were divided into two groups by the mean LS-BMD improvement at 24 months. That was 12.5%. They are called good outcome group, GO group, and non-good outcome group, non-GO group.
Click your pointers down here on the. So if you just click in the middle of the slide, it'll be fine. No problem. You're doing good. Now you're here. Second result, you're here. Yeah. So you just keep your pointer in there.
There were no significant differences in patient characteristics between groups. Percent increase of LS-BMD at 6 months in LS-GO group was significantly larger than that in LS non-GO group, 10.4% versus 4.0%. Percent increase of PF-BMD in LS-GO group was significantly larger than that in LS-GO group. There were no significant differences in the baseline values of BTMs and changes of BTMs from the baseline to 6 months between two groups. Next, all cases were also divided into two groups by the mean PF-BMD improvement at 24 months. That was 5.8%. There were no significant differences in patients' characteristics between two groups, except for the baseline CRP level. CRP in PF non-GO group was significantly high compared with that in PF-GO group. Percent increase of PF-BMD and LF-BMD at 6 months in PF-GO group was significantly larger than those in PF non-GO group. Percent increase of LS-BMD at 24 months in PF-GO group was significantly larger than that in PF non-GO group. There were no significant differences in baseline values of BTMs and changes BTMs from the baseline to 6 months between groups. And third result. Is it appropriate to combine TPTD and bio? Osteoclast may be confused. TPTD commands up-regulation to osteoclast. Bio commands down-regulation to osteoclasts. He might say, what should I do? All cases were divided into two groups, that is, the with bio and the without bio. Percent increase of LS-BMD in the with bio was better than that in the without bio, and there was a significant difference between groups at 18 months, 7.8% versus 14%. Similar findings were seen in the analysis of PF-BMD, and there was a significant difference between groups at 24 months, 3.6% versus 7.8%. Interestingly, a percent increase of BTMs in the with bio were high compared with that in the without bio. In particular, there were significant differences in BAP, P1NP, and TRAC5B between two groups. conclusion, daily TPT treatment was effective in opinion patients. Early response in BMD was one of the predictors of outcome in BMD at 24 months. BTMs were not the predictor of the efficacy of TPTD in this study. The result in the bioconcomitant show different trend from that in all cases, and these paradoxical results suggested that medicinal action of TPTD might be interfere with that of bio. Thank you for your attention.
Thank you very much. Interesting lecture. One question due to time restraints. So,
Real quick question, Nancy Lane, California. So why do you think there is this difference?
Mechanism of difference.
Right, but you're...
With bio versus without bio.
Right.
I think that hyperactivity of osteoclast is necessary to maximum the effect of daily teriparatide, but precise mechanism is unknown. But hyperactivity of osteoclast and osteoblast both is necessary to.
Right, but okay. I was just. I agree with you. I think you need
just,
to
okay, maybe you can speculate
Right.
after,
But I
because
did
we
have
have
one question.
no time left. I'm
The
sorry.
one question was on that last slide about of turnover markers. You had less turnover, right?
Yeah.
On the.
Okay.
I see. Okay.
You come to the front afterwards. You can discuss the paper. Okay, so we go to